Good morning. Today we're going to be talking about bleeding in pregnancy. Thank you, Dr. Omololu, for coming on the program. It's a pleasure to have you with us.
It's a pleasure to be here. Yeah, thank you.
Talking about you're a renowned obstetrician and gynecologist, and you work and you run the Island Maternity hospital in Lagos. And we're talking about bleeding in pregnancy. Now, it's a very broad term. Can you just explain to us what constitutes bleeding in pregnancy?
Well, thank you. Well, bleeding from anywhere, as we know, is a major challenge. And more so when a woman is pregnant because she's carrying a baby, then it carries a greater risk, because not just one life, but two lives, are at risk. So right from early in pregnancy, there could be challenges in bleeding during the pregnancy. When a woman is having a miscarriage, for instance, which we call, well, we don't use the term abortion anymore, a miscarriage, she could actually have some severe bleeding, sometimes if the womb is not emptied quickly enough. Also, you could have a pregnancy which is wrongly situated. That means what we call an ectopic pregnancy, in which the pregnancy is situated, within the fallopian tubes or outside the womb, anywhere outside the womb. And because those places cannot contain the pregnancy, so there could be, rupturing through where the pregnancy is situated, maybe in the ovary, maybe in the fallopian tube, and that leads to bleeding. Further on during the pregnancy, you may have where the placenta is abnormally situated, especially when it covers the lower part of the womb. And the placenta is a highly vascular organ, because that's where a lot of exchange happens between the mother and the baby. So because of that, there's a network of blood vessels, a complicated network of blood vessels that you find in the placenta. So there's a high risk of bleeding from the placenta as well. So when the placenta separates abnormally because of its abnormal position, or if there's anything that causes it to separate prematurely, that could also cause bleeding in pregnancy. Well, by the time we get in towards delivery, there are also risk of bleeding in pregnancy, usually still related to the placenta. Sometimes you could have some abnormal blood vessels within the womb, which may, as the cervix, that's the lower part of the womb, is opening up, those could actually get caught, and then there could be bleeding. And usually those type of abnormal vessels cause bleeding from the baby and not necessarily from the mother. And then where you have an obstructed labor, which is where the baby just can't come, that could lead to rupturing of the woman's womb. That means the woman's womb could actually give way and tear, and that could also lead to internal bleeding. And the one that we see most commonly is what we call postpartum hemorrhage, which is what occurs after delivery, where the womb is not able to contract. It has to contract to close up those complex network of blood vessels, I said, after the blood has been removed. And if that doesn't happen, then there could be bleeding from those open spaces. And then if an infection happens subsequently, usually after the first 24 hours of delivery, there could still be further bleeding. But all this is also with the risk of bleeding from, any other condition which a woman may have, which puts her at risk for bleeding, say if there's a hemophilia or some blood abnormality, and things like that. Thank you.
Yes, thank you. One of those things that people underestimate is really, how dangerous pregnancy can be, because it's a natural condition. Everybody, and of course, such a joyous one, but there's a lot, that can go wrong with a pregnancy. Now, one of the things that people also want to define or understand is there's something called spotting in pregnancy. How do you, what's the difference, for our listeners, laymen, between spotting in pregnancy and actually bleeding in pregnancy?
Well, spotting is bleeding in pregnancy because once there is blood, we say there's bleeding in pregnancy. It's just now to what is the bleeding? Is it heavy? Is it moderate? Is it light? So the light bleeding is what people tend to call spotting. And that could be normal in pregnancy, especially in early pregnancy, where as the pregnancy is implanting in the womb, where it's getting attached to the womb, the placenta is trying to form. You could have what we call an implantation bleed. In fact, this could be occurring up to 20% of pregnancies. That's about 1 in 5 pregnancies could have this early, bleeding called spotting. But then again, it could also be a sign of a miscarriage, because sometimes when the placenta is really the key thing during pregnancy when you're talking bleeding in pregnancy. A lot of it is related to the placenta. So as the placenta is forming, if there's any abnormality, maybe I'm even literally threatening that miscarriage, because sometimes in early pregnancy, you even see where the placenta has kind of separated a bit, and there's some bleeding behind the placenta as it's forming in that early stage. So there could be some slight release of some blood from there called spotting. But subsequently, in some pregnancies, that could resolve and the pregnancy could go on further. But if it's so usually a scan will help us differentiate between, all this. So by the time you do a scan, you see a normal pregnancy, normally sighted, then it's probably just spotting and can't find any other cause of a possible miscarriage. So that's just spotted in pregnancy.
Oh, thank you for that clarification, because it's something that people think are 2 different conditions actually, and it's nice to clear that up. You've mentioned so many different conditions, but we can't talk about all of them. But there are some that obviously, as you mentioned, PPH, postpartum hemorrhage, that is key. Can you talk about, just maybe take the top 3 that you think our listeners need to know about in terms of bleeding in pregnancy, so we can sort of dive into them in a bit more detail, such as things like what causes them, what are the risk factors, how can a person prevent themselves from having it, is there any way, what can they do, that kind of thing. So could you just pick your top 3 of all the conditions you mentioned, so that we can just talk briefly about all of them?
Okay, well, the top 3 in terms of occurrence will be postpartum hemorrhage, which is bleeding after delivery of the baby. Antepartum hemorrhage, which is bleeding while pregnant. So we can squeeze 2 into that. And we can look at ruptured uterus, because that has to do with maternal mortality. It's one of the strong causes of maternal mortality. So postpartum hemorrhage basically is where there is bleeding after delivery of the baby, and it's when the placenta has literally separated and there's still a lot of heavy bleeding. It can also happen even when the placenta also doesn't separate. So that's when the first thing you can say as a cause. Failure of the placenta to separate completely can lead to bleeding. And when the placenta separates, if the womb is not able to contract to control the bleeding and to close up the vessels, then that also leads to bleeding. Causes of postpartum hemorrhage, one of the commonest causes is uterine atony. That means when the womb is not able to contract. And things that can cause that, if the woman she's had a prolonged labor, that puts her at risk of uterine atony. She's had plenty of babies in the past for, growth parity. She's had 4 or 5 babies in the past. So the woman may have lost some of its contractile properties because of the recurrent stretching of the womb. If the woman has multiple pregnancies, she has twins, she has triplets, that also puts her at risk of postpartum hemorrhage. If the man has a full bladder, that's one of the strange ones, a full bladder after delivery, and that will actually prevent the womb from contracting down. And even if placenta comes out, there's still some tissue left within the womb that can also lead to bleeding. I know I've said a lot about the placenta, but also we must remember that it's a complete passage, not just the uterus. There's also the vagina too. So sometimes there could be tears in the cervix or in the vagina, which could also lead to this postpartum hemorrhage, which is bleeding after delivery. That's why in the management, you must also look to try to rule out those things as cause of bleeding. Woman with fibroids, depending on where the fibroids are situated and the size of the fibroids, that varies. But this is not to cause much alarm because it's not so common, and a lot of women do have fibroids. But it's not really common to see fibroids causing postpartum hemorrhage, but it is a possibility. So that's for postpartum hemorrhage. which is the commonest, and that is actually the commonest cause of maternal mortality in this, well, globally, to speak, globally. So antepartum hemorrhage, which is bleeding while, okay, let me go to ruptured uterus, because I said that also causes maternal mortality. And this is where the womb tears and the woman has a lot of internal bleeding, after delivery. This tends to occur commonly, usually in women who have had at least one baby before. And like I said, due to obstruction, so the womb is contracting to push out the baby, but the baby can't come through, and then the womb gives way and tears. So that usually tends to happen in where labor is usually unsupervised. That's where that should happen, because that should not happen in any center where labor is well monitored and supervised. So having your delivery somewhere that is well supervised will prevent the risk of a ruptured uterus. If a woman has had a previous cesarean section, she's had a previous fibroid surgery, those are things that can put her at risk, because those areas are potential weak areas for the, there are potential weak areas on the womb, which may lead to the uterus giving way. Still on ruptured uterus, other possible causes as well are injudicious use of what we call oxytocics, which are drugs used during labor to cause the womb to contract. So if any of these drugs are not used properly, again, talking about supervised labor, then that puts the womb at risk and the womb could actually tear.
What about antepartum hemorrhage?
Well, antepartum hemorrhage, that's bleeding while pregnant, and that's usually from the second to the third trimester. And that occurs usually when the placenta is abnormally situated. So, like the one I said in the early pregnancy with implantation bleed, when there is any bleeding subsequently, one should take that seriously, because that bleeding could change at any time and could become torrential, because placenta is now abnormally situated. And that's one of the major reasons why people have to be transfused with blood while pregnant. And such women may invariably need a cesarean section for delivery. So the issue of blood loss and transfusing blood comes in very strongly with placenta previa. And risk factors for this are, well, presence of fibroids in the womb, multiple pregnancy, having more than one baby in the womb because there's a large placenta mass. If there's a previous cesarean section too, that could also be a risk factor for it. So, and well, sometimes some uterine abnormalities as well. So those are the risk factors for that. The other one, abruption placenta, that's separation of the placenta with escape of some blood or some blood being concealed within the womb, tends to commonly happen with high blood pressure in pregnancy. That one usually has severe implications for the baby and sometimes the mother too. So those are the causes of antepartum hemorrhage.
Thank you very much. Their husbands, so that means their wives are pregnant. Their wives are at risk of this torrential bleeding, PPH. They don't know what's going to happen, and yet they're standing there and saying, "No, I'm not going to do it." I don't know. How do you deal with that? How do we, what do we do? Because it's unbelievable that they be saying that kind of thing when they know that there's not enough blood. We don't have enough blood in this country, and their wife is potentially going to be at risk of dying without it.
Well, it's just education. We just need to counsel and educate people, because there are just myths and misconceptions surrounding blood donation. And that's it's something we just have to get over, because the moment you realize that nobody is going to take blood from you if you're not fit, then you have nothing to be worried about. So if you're not fit, nobody's going to collect blood from you, and there's no harm to donating blood. And like some people say, when you ask them for blood, they say, "Doctor, can we buy the blood?" I'm like, from where? Nobody knows how to manufacture blood. The blood has to be gotten from somebody. And who would you rather, your wife or your friend or whoever, getting blood from? Is somebody who is safe to donate blood. So really, we just really need to continue to counsel people and hope that they realize that this is a product that only comes from human beings and can be given to other human beings who need it. This lady had 8 pints of blood, and 4 pints of fresh frozen plasma, which is a blood product. So sometimes not even just blood. There are other blood products which you get from blood, clotting factors, platelets, other things that, have to do. So sometimes not just the blood alone that we are giving, there are other things we are giving to help to maintain the body. And we can only get it from other, so people need to donate more.
They do. And if you look at it, that the husband would have donated maybe 1 pint for her. But how many did she receive? So she got a lot. And just in case we have people who are listening, who are thinking, you know what, I've been touched by this. I want to donate. Is there a way that they can come to General Hospital to donate, even if they don't have a wife there, but they are touched by the fact that these are women in need, women, giving birth, really the most precious people in our society, and most vulnerable, and they want to give their blood. How could they do so? Is there a way that somebody could come there tomorrow?
Oh, yes. The Lagos State Blood Transfusion Services are very active, and all the laboratories in all the Lagos State General Hospitals too are very active concerning this. So you can walk into any general hospital, they have a laboratory and a blood bank there. They'll be willing to, receive you, check you to see if you're, fit to donate blood, and, donate the blood, cancel you, and of course, go ahead and do the blood donation. I mean, there really is nothing to it. When I was in medical school, I used to donate every 6 months. And for the last 2 years, I've been donating once a year. They're waiting for me at the blood bank for my annual visitation as we speak, So there really is nothing to it. You can just walk in and donate blood and bring a friend along. And I mean, you'll be doing a lot for somebody.
Yes, and also for those who are listening who have organizations, I know that the blood bank actually can, if you, for example, have an organization and you want to do a blood donation drive, they'll actually bring people to your organization for those who are there who can donate and will give, I think there's a lot of awareness that needs to come to play, but I just want to thank you very much. Dr. Omololu, we've run out of time. So do you have any last words for our listeners?
Well, last word for our listeners is that prevention is better than cure. And it's always blessed to help others because we do not know when we ourselves need help. It's safe to donate blood. We should try to donate blood. No man should die because she is having a baby. Bleeding is the commonest cause of women dying in pregnancy. And these are actually preventable deaths. So when you donate blood, you may just be helping to prevent a death.
Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.